we'll just get right into it. So, what were the feelings that let you know something was not right back in August of, was it 2014 or?
2014, yeah. So in 2014, I was running programs for a college with lots and lots of high school students who were coming to the college that summer to be part of arts programs. And it was a hectic, crazy job. I had 350 students I was working with from all over the world, and I was exhausted. Normally, I respond to situations like that with all adrenaline all the time and then crash like the week after the program is over. But I had felt poorly, like stomach upset, like everything upset my stomach. I was very fatigued and tired. So I knew like something was up. And I thought, it's a cold, it's allergies, and had gone to the medical practice on campus. And they said, oh, you just have a cold, here's some Flonase, and didn't think any of it. Then a couple weeks later, the program ended, and I felt pretty crappy, and I started to have really bad headaches. I'm a migraine sufferer from my early 20s, but it was nothing like migraines. It was these headaches that would wrap around the back of my head, and just like the worst headache of my life. So I ended up going to the urgent care at the University of Chicago hospitals, which I had previously gone to, and as soon as I came in and talked about my symptoms, they were very concerned. And first they wanted to do a spinal tap, and that scared me, of course, thinking like, oh, I just need better migraine medication or something. I knew something was wrong, but I had no idea that a blood test later that day would lead to me being admitted to the hospital that same night.
Wow. So it happened very quickly. If you could laundry list those first symptoms, what were they? Just laundry list.
Sure. I think fatigue, headaches, upset stomach.
Okay. And there was something in you where you were like, this is all very foreign, this is not right. And that's what led you to go straight to, you said urgent care, or?
Yeah. So there's an urgent care at the hospital where we live.
Okay, perfect. So can you describe, so then they did a blood test, they took they did the blood samples and everything, and then how long did it take for you to get the results, and yeah, what happened then?
Sure. So at the urgent care urgent care is an offshoot of the main hospital at University of Chicago. So they have labs at the ready. So I was able to go from my urgent care appointment across the hallway, get a blood sample taken, and then I came home. I live about 10 minutes away, and they called maybe an hour later saying, there's something not right. We're thinking about having you come back to do the blood again, but just keep your phone by your side. I'll call you back. So actually that evening we were packing to go on a trip. It was going to be my first trip with just my husband and I. My daughter was little. And so I was making dinner and packing, and the phone rang again as we had sat down for dinner. And it was the doctor that I had seen at urgent care, a young doctor, saying, this is very serious. You need to come in to the emergency room right now and pack a bag. You're going to be staying here for more tests and more observation.
Okay, wow. I mean, I know this was some years ago. I imagine though you don't really forget that feeling. Can you describe sort of the reaction, and your husband, I imagine, was with you. You were packing for a trip. How did that all play out?
I mean, we don't have family nearby. So our first thought was, how are we going to do this with, I think my daughter was 3 at the time. How do we do this with a 3-year-old in tow? So we just kind of, we're like this to this day, where we just strategize, and everything we just go to crisis mode. And for us, the feelings don't come till a little bit later. It becomes, what are the practicalities of this? I think parenthood comes with that. And so my daughter's good friend lives 3 doors down, and so we called them and they didn't answer the phone, and so we just packed a bag for Twyla and walked over there trying to say, like, Mom is not feeling well, we need to find out what's going on. And she immediately was like, it's my first sleepover. This is amazing. So she was just excited. It was very odd. So you're putting on a face for your child. And we just knocked on, my husband took her to our neighbors, knocked on their door, and they were in the middle. They didn't answer the phone because they were in the middle of like story time for their girls, but welcomed her with open arms and said, whatever you need, which really made us be able to take our parent hats off and be able to absorb some of the situation. And it felt really hollow. It felt like dread. It felt like something I'd never felt before.
Right. No one ever expects to get that call. You have to pack your bag. Let's go. So, okay. So you're able to take your parents' hat off. You get in the car. Describe what happens once you get to. And did you go to the main campus of the actual hospital at that point, or?
Yeah, so we just a little clarifying detail. Um, my husband works for the University of Chicago, and my daughter went at the time to the laboratory schools, which is associated with the university, and we would very much call ourselves a university family. So, like the majority of our friends work for the medical center or are academics. So we're kind of in that world already. And it's just down the street. I mean, my husband walks to work, and I previously have worked there. But so, it felt we weren't going anywhere new or different. Like, this is our neighborhood. It's like just a block from my husband's office, a couple blocks from my daughter's school. So it was a bit surreal in that regard because it was just like, oh, we're driving past our grocery store and I know where to park and all, just very strange. And knowing that we were going there, n- not knowing like what the next piece would be. um I mean, we were totally clueless that I would be in the hospital for the next 6 weeks, like, and that we would be dealing with this for, you know many years later as well. Like, that was, we were pretty darn clueless, and we were hopeful, scared, um probably making really stupid jokes because that's kind of how we deal with things.
Humor can really get people through these times though, right? It's sometimes the only sort of last resort. So Mary Claire, you go to the hospital. Describe how they, what they did. Did they start with tests and scans? Did you meet your like oncologist right away? What happened?
So what was surreal is that and I'll use a different word. What was just absolutely weird and strange is that we had an appointment at the ER, which is not something you do. Like, they knew we were coming, so it almost felt like going to like a restaurant and saying, "Here's my reservation. I have a reservation." And they had a room ready for us, and it didn't take very long until like three doctors, at least two of them oncologists, came in the room and kind of laid it out, that based on my blood sample that they had taken earlier that day, that my white count was really strange. The rest of my blood results were out of whack, and that their best understanding at that time was that I had leukemia of some kind, some sort of a blood disorder, and they did use the word cancer, but that they needed way more information. But what they did know is that things move very, very rapidly with blood cancers and blood disorders, and that to be able to provide me the best care, I needed to check in to the oncology floor, the hematology oncology floor, at the new hospital just a couple steps away. um, and that, things, we thought things were going to happen pretty quickly, but it was a Friday night. So we actually had like a weekend in the hospital where they kind of checked in a little bit, but I didn't really see the person who would become my team, the six people that would come and really talk to me till Monday. So it was very odd, and I was like, seems like so financially crazy to have me stay here for 2 days and just kind of check in on me, where I felt fine in regards to, I mean, I didn't feel awful. I mean, I felt a little sick, but not terrible.
And so during that weekend, what you're saying is they wanted you just to check in so you would be there in case of something, but they didn't really do anything. Nothing happened.
No, I didn't have a bone marrow biopsy until Monday. I mean, Monday they hit the ground running at like 7 a.m. and it was meeting with teams and learning what the plan of care would be. We would start immediately with chemo and we would do a bone marrow biopsy to get more information. All of those things like went into place right then. It was a head spinning day, but we had that weekend to be able to kind of rally our team and support and to do some research on our own. Um, so we actually went into meeting with the oncology team pretty informed. A good friend is a oncology pharmacist and she deals a lot with transplant patients. And so we're pretty well informed. There aren't first line treatment for someone who is rather on the healthy side like myself. Is there, it's pretty standard. There's not a lot of um, different options.
Okay. So Friday night you go to the hospital, you're checked in. They didn't really tell you much other than that was the first time they said cancer. They said best guess leukemia, but we need to do a lot more.
Hmm.
Nothing happens over the weekend except for you mentally preparing. Friday, I'm sorry, Monday morning, they do the bone marrow biopsy. Is that the first thing that you undergo? And if it is, can you explain that? And I did go under that. I also had one too, but very curious to
Yeah.
see what your experience was.
I've probably had about 20 bone marrow biopsies at this point. So it's um,
Oh my
the
God.
first one, I had no idea what I was in for. They basically explained it to me that we're just going to take this tiny little sliver of your hip and it's a very quick procedure. It's done at the bedside. We don't have to put you under or anything like that. We'll numb the area. So in my mind, I had thought of like when I had a mole removed or something like that in dermatology, that it would be something akin to that, but a little bit more. I think in a lot of ways, my doctors and the way the folks that I've worked with my team have tried to not totally scare patients. So not all details are shared before certain procedures. And so this particular one, the look in people's eyes was like, this is, serious. This is, you're going to feel a pinch and a burn. There might be pressure, things like that. What I realized pretty quickly is that it's sort of like getting a root canal on your butt. Is the best way that I can put it, because it's, they do a little bit of work and have um, a bit of a drill, and if you feel pain, you have to. I feel pain, um, and I was pretty well drugged, but over the years of doing this, I now know like my favorite cocktail of drugs to have before a biopsy. But no, it was pretty ridiculous situation. My husband was sitting there also having no idea what was going to happen. My mom had flown in from Virginia, and so she was on like the little patient couch like at the end of my bed. And it's a teaching hospital, so they asked, is it okay if this new doctor gets to do his first biopsy on you? And we're like, sure, we don't know any better that if this is hard or not. Um, and when he's putting the numbing agent into my backside, he squirts it in my husband's eye. And so we're laughing and all that sort of stuff, but he actually was not able to complete the procedure because I guess I have very hard bones, and you have to put an unbelievable amount of pressure to get all the way into the marrow and get what you need. So the nurse practitioner had to take over, and she did a great job, but it was very strange and it hurt a lot.
Wow. First of all, kudos to you for, I was at a teaching hospital as well. I don't know. But, actually very interesting though, Mary Claire, I haven't spoken with people who have undergone multiple, much less 20, bone marrow
Yeah.
biopsies. So for people who are going into it, what are your tips or what advice do you have? And I know that it varies patient to patient, but you said you have determined your favorite cocktail. I mean, maybe you could describe all of that.
Sure. So I think anyone who's undergoing a procedure where you're either getting your port in, a PICC line, a bone marrow biopsy in particular, it's good to know how your body reacts to different medicines. So if you know you're the type of person that whenever they try to put you under for something, you vomit or you can't handle Dilaudid, for me, if they give me Dilaudid, which is a very typical drug to be given, that kind of mentally you're out of it and you don't really feel the pain as much, that for me was successful as far as no pain, but I would be vomiting for hours after and just feel way out of it and would just have to sleep for the rest of the day. So I realized for me, knowing that that was not the right drug for me and I had to ask for something else, I ended up with what they think is a lighter alternative, which is a heavier dose of Ativan mixed with Benadryl. But that really, I'm not mentally engaged with the pain. Certainly I can feel things, but with Ativan, you have a very limited memory from that experience. It does incur some memory loss, which in this particular case is great. So I was totally down and okay with that. Also, I was able to, previous times in outpatient settings, after using just the Ativan, I could sleep for a little bit after the procedure on the table, maybe an hour, if that. And then I'm a little out of it. I certainly can't drive myself home, but I'm able to walk the block or two to the parking garage, and I'm able to, you know, have another cup or two of coffee at home and kind of restart my day. It doesn't derail everything. And
Right.
it took a while to figure that out. It also took a while to figure out that there were some members of the team that were seasoned and more experienced in doing difficult bone marrow biopsies. I've learned that I'm one of those people that it is tricky. Some people have more forgiving bones, I think, and I don't. So I learned the same thing goes with blood draws. I'm a really tough stick. And so you need someone who has the combination of skill and confidence. Because if they have the skill, but they don't have the confidence, it's not going to happen. Likewise with if you have the confidence, but not the skill. So those are some things that I've learned over the years.
That's really great advice. I love that. Okay, so the bone marrow biopsy, how long did it take to get the results from that?
I think the bone marrow biopsy, we received some news the next day. Again, they had everything you would need on site at this particular hospital because it is a research institution. So they were able to get some of that staining back quickly, and they were able to get like a more deeper understanding of how many blast cells. But with the type of work that they're doing, they also do a couple different other stains that take more time to develop. So then I would receive more information later in the week, if not the following.
Do you remember what they were able to tell you the following day?
They were able to tell me pretty much that this is AML leukemia based on what the cells looked like. They were able to tell me my percentage of blast cells, which really didn't mean much to me at the time, but that it was aggressive and that I wasn't. There's no stages for leukemia, so there's no stage 1 and stage 4. Like there's nothing like that. So it's percentage of disease, and the treatment is it's not a cancer that is often found very low levels. So like it is in the 20 plus percentage of these abnormal white cells that are overcrowding and hacking your body. So for me, like learning that I think it was like 20 or 30% didn't mean a lot, but knowing that you're not supposed to have any, that it's considerable. And it meant that they needed to move and act quickly, because once the body starts replicating these cells, it's just going to continue and continue until it kind of destroys your body.
Okay, so it's fast acting, it's very aggressive. Outside of that bone marrow biopsy, did they need to do any PET CT scans or MRIs or anything like that?
I don't really remember. Probably, but I don't really recall at
Okay,
that back then.
no problem. Okay, so after you get, was it after you got those first results from the bone marrow biopsy Tuesday that they then said, here's the regimen we're going after, or,
They
when did
had
you
already
start?
they had already presented a regimen. They had already presented some clinical trial options, mainly just different dosages of different chemo agents that they thought might be better for me because I was in my 30s. Typically, people who get leukemia, if you look at the percentages, high amounts would be infants, very, very young children, as well as older adults over 70. There's a very, very small group of young adults who would be classified between 18 and 40 that would develop this disease. It's you know, not unheard of, but it's pretty rare. So luckily, where I was at the University of Chicago, they have an adolescent and young adult clinic for blood disorders and specifically leukemias. So I was able to be with kind of the foremost experts, not even knowing it, to starting to like talk to people in my research and my husband's research, being like, oh, so I had the option of having one of the top experts, Dr. Wendy Stock, as my oncologist. And it was an interesting process because she wasn't rounding when I first came in, but she learned about my case through the weekly transplant meeting. And she came to my bedside and asked if she could be my main oncologist, which was just so cool. It was very patient facing, very warm to have someone say, can I be your oncologist, and here's my credentials, and this is why I'm interested in you.
Wow, I'm so glad you got that response and that it was essentially in your backyard.
Yeah.
So, so how could you describe the regimens of the 6 weeks of chemo? Is it, and you were inpatient the whole time? So,
Sure. So I don't remember the exact names of the drugs, but my regimen, first off, is called induction chemo. And induction chemotherapy, I believe it's a 3-1. So it's 3 drugs or 3 days with a certain cocktail of drugs. And I was only given chemo, very, very high doses of chemo, I believe over 2 weeks. The reason I was in the hospital for 6 weeks is because you cannot leave until your blood counts are at a level where if someone coughed in your vicinity, you wouldn't get that and it would become pneumonia and die. You need your immune system to be functional in the smallest amount possible. And when you're given those very, very heavy, high dose chemos, it just destroys your immune system as well as destroying the cancer. But that's a major side effect, and they don't want to release you back into the world, um, even if that is isolation in your home, um, until you've reached a certain standard with your blood counts. And it took a
right.
while for mine to come back.
Okay, so you were neutropenic, is that right? For that time?
Exactly. So I was neutropenic. Yep.
Okay. So the 2 weeks, can you describe the process so anyone who might undergo the same regimen understands what that process is like?
I think it was a bit kind of underwhelming process. I was hooked up to, by that point, I think I had a PICC line installed in my arm, which was again a bedside procedure, somewhat uncomfortable, but not terribly, which is I mean, I think I still have the scar under here somewhere. So I've had two PICC lines, so who knows? But so that's basically a line that goes directly into your heart from your arm. And that would be a way for them to easily give you medications and drugs without having to start an IV each time. So it's sort of like a semi-permanent, you don't have PICC lines for too terribly long, but 6 months is typical. And so I was hooked up with that. And then once a day, I would be given a drip bag of those chemo agents. It was typically a couple different bags hanging from an IV pole. And I was able to, the first couple days of that regimen, watch TV and be kind of up and about. They said walking the floor was okay, but I was not allowed to leave the hematology oncology floor or go to like the food court in the building or anything like that. But I was wearing my normal clothes. I was able to take a shower. I was able to do kind of my normal things the first few days. After that, the side effects of chemo, where it really is starting to like ravage your body, kind of took over. So I had, my blood counts dropped, red and plasma and all those things were problematic. And I was started to be on that IV pole a lot because I was receiving platelets, I was receiving red blood product, I was receiving fluids as well. And then as the weeks went on, they added potassium and magnesium because your body is really being depleted of a lot of the essential things it needs to run. So not only was I starting to feel poorly around the third day, no appetite, I did get a rash, which they think was from the red blood product, happened once and never again. I was very uncomfortable. We realized at that point that you can get calamine lotion in a spray form. So it was super helpful to have my mom and my husband and some close friends who could run to CVS or the drugstore to be able to pick little things you need up. I packed a bag for like one night. So I had no clue that I would be needing like my family to like make sure I had clean socks and underwear and that I had like comfy kind of pajama type clothes. So that was really helpful. It was that first, week or so was kind of like, well, what do you need? And setting myself up to be pretty self-sufficient.
Gotcha. Okay. So to be clear, it was infusion, and then really on one day. The second day was your infusion,
I
or
think it, so infusion as far as chemo agent or as
yes,
far as
chemo. Just
so
yeah.
yeah, I mean I think the chemo was like 4 or 5 days in a row. Um,
Okay.
Yeah, I mean,
Okay.
it's very high dose. It's it's the highest dose they will give. It's akin to what they give pediatric patients, young pediatric patients, because our bodies can handle more.
Got it. So it was 4 to 5 days of chemo straight, and for you, it was 2 weeks the first time. Is that right?
Yes.
And your
Yeah.
side effects started to feel them on the third day, about.
I want to say the third day. Yeah. I mean, I think initially was that huge rash, head to toe, just itchy, 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 and felt yucky. As soon as I presented with that, they had dermatology come and check me out. And, when you do have a rash on the outside of your body, there's something going on in the inside as well. And so you want to make sure that that can be looked at and dealt with quickly.
Gotcha. And how long did so I know the rash was sort of an anomaly because it happened once, but
Yeah.
you had also, I'm sorry, you mentioned, could you laundry list the other side effects and when it started to feel better and what helped you with those side effects?
Sure. So my main chemo side effects from the first induction round were uh, really poor appetite. Things started to not taste right, um, and just fatigue, overall fatigue, upset stomach was another thing. For, sometimes diarrhea, sometimes constipation, back and forth with that. Most everything was well controlled with medication. I was given any opportunity I wanted to be able to take anti-nausea medication, which was helpful. I needed to figure out which ones again would be good as far as still letting me be somewhat conscious, because many of them will just knock you out and make you very, very tired. And you can sleep through all of this if you want to, But realizing that I was going to be there for a few weeks, I wanted to do something. I wanted to actually spend my time a little bit better, especially since family had flown in to be with me. So figuring that out, ginger ale was very helpful. Ginger candies were helpful. For upset stomach, the main thing that has helped me over time has been heating pads. And in the hospital, a nurse can give you a little packet that they shake together and pop, and it's a nice hot um, little kind of a pillow that you can put on whatever is hurting you. And that, for me, especially while you're waiting for other medications to kick in, is a lifesaver. It can also be very soothing if you're trying to get to sleep. So those were always things that I was known as the patient that when the nurse came and did her rounds first thing in the morning, she'd load me up. She'd say, like, here you go, here's 3, you'll be good for the day. And when I'm home, I use my heating pad that plugs in the wall. So those things were helpful. I think still being active, trying to get out of the room, trying to walk around was helpful for digestion, for appetite, for overall fatigue. The fatigue's going to hit you. You're going to take a nap. You're going to go to bed early. You're going to feel like watching, a movie or TV or doing something quiet. You're probably not going to want to entertain a lot of guests. Luckily, we had, maybe once a day I would have some folks come over for maybe an hour, but the rest of the time I spent mainly alone.
And actually, on that note, you did you have family in place to kind of be the filter? Because people, I'm sure, are trying to get to understand how is Mary Claire doing, but you're trying to minimize too much of that contact and having to explain yourself, right?
Yeah, no, it's really tricky to figure out that. I'm a pretty open book, so I shared on Facebook. I contacted my employer and let them know. They came, like the director of my department at the college came, and my assistant came, and that was very strange. In hindsight, I would not have permitted that. I think having people see you at your lowest moment is private. So I think I also learned a lot after I had my daughter. I did not need to have my best friend in the delivery room or my mother-in-law, but you live and learn. So yeah, so I think I did not have that in place. I did not have someone to filter all the people coming into my orbit at that point at all. I was kind of managing that myself, and it was difficult. It was hard. It was like in some ways reliving um, the diagnosis all over again every time you had to tell someone what you had been, what cancer you have and what's happening, and um, also the leukemia journey is quite different than a breast cancer journey or the treatment protocols for colon cancer or anything like that. Like there's much more inpatient, it's much more high risk, it's very fast moving. The thought of even getting a second opinion, it's just not possible. So I think the majority of people I were talking to, unless they were someone who was already in the medical community, which we have some friends with that, they were just confused. They just were perplexed. So that was difficult. I think it did make me kind of accept my circumstance faster than I would have if I would have kept everything private. Um, yeah,
Okay, wow, that was thank you for sharing that. Uh,
sure. I
d-
haven't
d-
really thought about that. Yeah.
yeah, yeah. Do you have any advice for people who are just now going through the process or about to on how to manage that part of it?
I would say, particularly, what's helpful. Let's see. I think setting up some sort of a website that is private, such as Caring Bridge, My Lifeline. There's a number of other ones out there that is not just your social media account or your email, can be really helpful as far as scheduling goes. Um, you can if you would like to, you can update and have a blog. I started with that process. It got exhausting very quickly. Some people have their spouse or a family member updating that information about you. It's truly up to you what you would like to share. But I think for many of those websites, there's a way to schedule food delivery and set up, if you need to raise some money, or if you need someone to offer to clean your house, or something along those lines, walk your dog. For us, it was really helpful because we wanted to create as much normalcy for my daughter as possible. We didn't want her just, excuse me, we didn't want her just hanging out at the hospital all the time. That's just not realistic, even though she really didn't know what was going on and thought it was just like this fun thing to go meet all these nurses who thought she was adorable, and get all dressed up to go see mom. What we were trying to create was some normalcy for her. So we used Caring Bridge to make play dates, to request play dates, to request food. One of the things that we being busy professionals often had our groceries delivered through a service called Peapod, already before cancer came into our world, and letting my coworkers who live all over the place know that that would be something that would be helpful beyond just delivering us food. We're a little complicated. My husband's vegan. I'm vegetarian. So many people who don't eat that way were kind of confused as to, well, what do I bring them? So just the grocery gift cards, which could be done through email, were just absolutely wonderful, because we were also dealing with a pretty quick, significant loss of income. So feeding people is important.
Right. Okay, great. And I'm going to ask you more on that the very last section. So thanks for letting me kind of go on a tangent there.
Yep, no problem.
So you had this induction chemo. It was basically almost just 2 weeks straight of this, infusion of chemo agents. What happened after that?
Sure. So after that, I was kind of just stuck at the hospital, stuck in my same room, and it became a typical routine that I would be, you know, woken up at 6 a.m. and they would do a blood draw and weigh me and take my temperature and my blood pressure and all that good stuff. And I could snooze a little bit after that. It may have even been like 4 o'clock in the morning. I'm not sure. It was crazy early. And then I would see, depending upon the day of the week, if it's the weekend, I may not see a doctor at all. But during the week, I would then see a doctor sometime between 9 and 1. It was very vague when that team would be rotating through doing rounds, and they would say, here's your blood counts, here's what's going on, and specifically looking at the panels, you need potassium today, or you need this today, and then asking me like, well, what are you feeling, what do you need, as far as mitigating side effects and symptoms. So that just became the routine, and I I watched, I think, the first 2 seasons of Scandal. And talked to a lot of the nurses and the nurse assistants about all of that. Yeah.
Wow. Okay. So yeah, there's a lot of waiting around, waiting for the levels to go back up, your neutropenia to go away. How long did that take until then? I'm reading your notes. You had to do, was it consolidation chemo and then a transplant, or?
Yeah, those were in the next months to come.
Okay, gotcha. So how long did the waiting at the hospital last until your levels were okay? And then did you get discharged? Like, walk us through the next few steps.
Sure. So after 2 weeks of chemo, I was still in the hospital for 4 more weeks because we were waiting for my counts to recover. It was unbelievably boring and stressful, because I was a bit of an outlier. Typically, it takes a week or two for counts to come back, but my body really fought against that. And I was not a candidate at that particular time due to the regimen that I was on for something like a new Lesta that would enable that to happen. It would cause more cancer cells to grow at that juncture. So I was just kind of stuck there. So 6 weeks in total, and then I was able to go home and be with my family and rest my body a little bit. I was still going into the outpatient clinic at least once a week, sometimes more, depending upon side effects and symptoms. Getting an understanding of what's going on with my body. We had also early on, once my body, they realized after those 2 weeks that it was responding to chemo and could put me in a temporary remission. They began the process through the bone marrow biopsy and 1,000,001 blood samples to look to find out what my biomarkers are, to what's unique and special about my genome and my specific cancer, to provide personalized care. And they would also look to see all the different special things about my bone marrow to be able to find a match in the registry. I don't have any siblings, so I didn't have any family to go to for that, but it's a very long and arduous process to find a match, a good match. It takes months sometimes. So they began that process very early to see if that was going to be a possibility for me.
Okay, perfect.
Oh, sure.
Okay, yes, go ahead.
In a perfect world, if you had a donor lined up, you would have heavy duty chemo and then immediately have a transplant. That's not how the world works. It takes a lot of time to get your donor in place and to make sure that you have a good match and that all the legality is put together. So the initial chemo is to really test your body to see if you can get into remission. And during that process, while you're waiting for that donor and that time to be set up for your insurance to approve everything, your body will start to probably make cancer cells again. And most patients that I've spoken with and that I know, we've all had something called consolidation chemo. You may even have multiple rounds of consolidation chemo. And that is, again, another couple day stint of heavy duty chemo agents that will keep your cancer down and your white cells at a more normal level. And it's not as intense as induction, but it's still a heavy duty dose. For me, I went inpatient, and by that point, my body was like, "Oh, okay, so you're supposed to suppress everything, and then I'll make some more cells." So I didn't have to spend 6 weeks in the hospital. I was very, very fearful of that. I only spent a week in the hospital for my consolidation.
Great. I'm sure you were nervous, having experienced that neutropenia before. So the consolidation chemo, is it one infusion of the chemo agents instead of like 4 to 5 days, or?
I think it's 2 days. Mhm.
Okay. And side effects, did it also, was it just sort of a mini junior version of the induction chemo side effects?
The big difference in side effects at that point is we had realized that I had become menopausal. So I was going through hot flashes. I was going through just feeling out of it and weird, and my period had stopped. All of those things. So I was also kind of going through this really quick month of just drenching my pillow every night and being very unhappy and knowing that that was my like very sped up version of menopause, where for women it's typically over years. Mine was over about a month. So it was intense. So but I also going through consolidation, not only the menopause but also a lot of upset stomach. Like my skin was uncomfortable. I think I was having some just dryness, and part of that is just being in a hospital environment and having being hooked up to things and things like that. But so my skin was very fragile. But nausea, upset stomach, loss of appetite, food tasted weird. I started eating just a lot very plain food. Salt was helpful, hot sauce was helpful if I could tolerate it.
Mm.
Those kinds of things.
Okay. And did they give you the shot to purposefully, intentionally put you into the menopause, or was the?
No, my
Okay.
menopause was completely a side effect of the chemo.
Wow. Okay. Gotcha. Okay. Thanks for clarifying.
Sure.
So then the transplant. So walk us through that process. So you go through this consolidation chemo. At that point, had you gotten matched? And
So with the consolidation chemo, they had realized that I'm the whitest person alive and that there are many matches for me. But yeah, so for consolidation, they found out that I certainly had some matches that were potential in the system. So it was very vague at that point. They said, there's about 5 or 6 people that are a possibility worldwide. Germany being the biggest donor pool, and those are European folks. A lot of your bone marrow and your makeup has to do with your race. And for me, having European origins on both sides of my family, pretty much English, Scottish, German, I was not a big mutt. So it was easier to match me, which is very unfortunate for many people who have much more varied lineage or come from other nations. So I was able to be matched. And at first, the doctors really wanted to consider and look very closely at each potential match. So they were looking at things on a chromosomal level, because you want, much like a heart transplant or a kidney transplant, the body may reject something foreign. And so to mitigate that, to make sure that the chances of that are low, the matching factors, I believe there are like 10 to 15 of these parts of your chromosomes that they're looking at to see if they're going to match with that donor. And so the more matched you get, it's called a matched donor. You can also get an unmatched donor where they've got half of the chromosomes, much more risky, way more complications after the fact. So the closer the match you can get, the better outcome you're looking at.
so the good news for you was that you were going to have a good pool of probably pretty good matches, right?
Yes.
Okay. And so how long after the consolidation chemo, did they have to keep you in the hospital through the transplant, or did you get to go home in between? And how long after, yeah, did the transplant take place?
Yeah. So I had consolidation at some point between induction and chemo. I think there was maybe a month apart between each. And so I was able to be home for a bit of that time before transplant while all of those details were being put together. Lots of legal paperwork, lots of clearances, making sure there's a bed available for me for a prolonged period of time on the floor, which was problematic. But we're able to secure that. And then, figuring out how those cells were going to get to me. I found out later they were coming from Connecticut. But, just because someone has registered themselves within the bone marrow registry doesn't always mean that they will follow through with giving you their cells. So, they have to, narrow it down to the best matches and reach out to those individuals to see who is willing to move forward with a medical procedure to save someone else's life.
Absolutely. So
Sure.
there's a process, and how long after did you finally get the match? It was, everything was check done, and if you could walk us through the actual transplant process.
Sure. The beginning of November in 2014, I was brought back into the hospital for my transplant. I was given a day's worth of heavy duty chemo just to make sure everything was suppressed so that the new bone marrow, when it came into my body, would be able to have space and room to replace mine. There were, a couple kind of intense but exciting days leading up to that transplant. It's a risky process. Before the transplant, I needed to get a Hickman line installed, which is a central line that's in your chest wall that is a better multiple line into the heart, into the circulatory system to be able to deliver drugs. It lasts longer than a PICC line, and they require a 3-line Hickman for transplants so that you can get hooked up to a bunch of different stuff at the same time. And that was my first process, was going into IR to get that put in, and then I was brought up to my room, and then given heavy duty chemo, and then transplant happened on November 6th. And you just, it seems like any other blood donation. It seems like you're getting a bag of plasma. It's yellow, and you know how far it's come from, because if it has a preservative in it, it smells a little bit like chicken soup. So you can smell down the hallway when someone's getting a transplant if it's come from Germany or come from further away and had to be couriered over in a slower process. Mine was fresh, so it didn't have any of those smells. So we knew, like, okay, this is good. The only thing I knew about my donor was that he was in his 20s and was young, and that's also a good factor. I didn't know name, I didn't know where, I didn't know if I would even find out those details till later. You have to wait a number of years. So it seemed just kind of like a regular donation coming down the line, but we knew that these were magic, these were special cells. And so we're all kind of, excited, and it's a birthday too. So they sing happy birthday to you because your immune system is brand new, just been born. So there's some of those things. I think my mom brought a balloon. We weren't allowed to have fresh flowers or anything like that, and I did not want any cake. So we did that. It was tricky because for the transplant process, the cold and flu protocols were put into place by that point in the year. So children under 14 were not allowed to visit. So I was not allowed to see my daughter during that time. And I feared that it would be, I'd be in the hospital for 6 weeks or more based on previous experience. So that was really hard. We were doing FaceTime and all that kind of stuff. I missed out on Halloween that year. And so they sent pictures and all that. And it was hard. But then after you receive your stem cells and they're going through your body and all that sort of stuff, it's really kind of a waiting game to see how your body's going to react. And there's many mitigating things, that drugs that they can give you, steroids and things like that. They begin kind of this protocol the day before the transplant. Pills you're taking. So you've got antivirals, antibacterials, drugs to prevent pneumonia, steroids to help your immune system. All these different things get put into place, that also inform you that your body is heavily at risk, because you have a new immune system.
It's a lot going on in your body. How did your body react? How were you feeling? What were the side effects? And how long did you have to stay in the hospital for this observation before you were able to go home?
Sure. So the side effects were very similar to the chemo, and more than anything else, it was the chemo that I was feeling side effects for more than the transplant. Intensive, very intense fatigue. And the steroids also made me feel a little bit weird. I was on a pretty high dose of steroids. And, lots of upset stomach, did not want to eat. And at that point, I did have mouth sores, which with high dose chemo and many other types of chemo is common. They did give me one type of chemo that is very much, I don't remember the name, but it's very much known for creating mouth sores. And I had mouth sores all the way down inside my throat. So I couldn't speak. And I had a very difficult time swallowing. It resolved itself after about a week. It got slowly better. It was unbelievably frustrating because the 3 things the doctors are constantly telling you to do after transplant is to move around, go for walks, and eat and drink water, 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 water. Like they're measuring how much water and food intake and exercise I'm doing every single day. And I was not able at some points to do what they needed me to do, but I worked really hard at it. And even if it was, I can't eat, but I certainly can get my husband to pick me up the highest calorie banana smoothie he can find with full fat ice cream in it, and I'll have a couple sips, and that's better than like nibbling on a cracker. It was also difficult because being vegetarian, there wasn't a lot of food on the menu that I could eat. So I ate a lot of peanut butter and jelly. Yeah.
Um, we have 30, like less than 30 minutes and a lot to
Oh,
get through still. So no, really, thank you for walking us through all this. I will have to circle back on a couple things I'm going to skip
sure.
over um, to just get you to maybe reply via email if that's okay.
Absolutely.
Perfect. But I am curious, this December, through March, isolation at home. I mean, that's a long period of time. What does isolation at home mean? I'm also assuming that the transplant went well because they let you go. And
Yeah, my transplant was very successful in 2014, and I was able to go home after 3.5 weeks in the hospital, which was amazing for everyone. A very scary thing was that the main doctor who was on call, not my oncologist, but the main transplant doctor I was working with, you deal with who's on rounds for those particular weeks. When it was time for me to go home, when my cells had recovered enough for that to be safely done, she was not comfortable releasing me since I had a preschool age child at home. And it took advocating for myself and working with my nurses to figure out what other doctor I could ask to see to figure out how this would work. I realized and did some of my my work talking to the nurses, realizing that the doctor that I was working with, that she was rather young. She didn't have children, didn't really understand that the whole reason I went through this process was to be a mom and to be with my family. So I ended up meeting another doctor who was wonderful and has 5 children. And so he got it, he understood. And we ended up making a deal. We pulled my daughter out of school for the first 100 days after my transplant. The first 100 to 120 days are meant to be high risk. Patients are in isolation at home or in the hospital, and you can't really go anywhere. You could, it's mask and gloves. It's very similar to this pandemic. Very strange. A lot of that is because your immune system is being suppressed by immunosuppressant drugs, and so that you do not reject the new cells. And they will slowly wean you off of that if you are not having graft versus host acute symptoms and reactions. And I was able to be weaned off of those pretty quickly, which pretty quickly is a number of months. But yeah, no, I was definitely just, instead of being inpatient, I was the patient at home. And it's also critical to have a caregiver during those 100 days. They would not allow me to have a transplant unless I had a 24/7 caregiver with me at my side, monitoring me for any issues that may arise. I also was not allowed to be further than 30 minutes away from my hospital.
the caregiver, so you had to hire someone, or was that your husband? Or
No, my husband needed to take care of my daughter and needed to work. So we brought in my mom.
okay.
My mom was my caregiver.
Oh, that's wonderful that you had her there with you. So the isolation it's isolation in terms of it's you, your husband, your daughter, your mom. Those are the only people who can be around you in your home. Is that right?
Yes. If someone didn't have, you just basically had to interrogate everyone. Like, do you have a cold? Does someone in your life has a cold? I made my husband stop going on public transportation. There's certain foods you're not allowed to eat. You're not allowed to eat fresh berries. You're not allowed to touch soil. You're not you're not allowed to be around flowers. You're not allowed to clean a litter box or pick up dog waste or anything like that. You're not allowed to do the dishes. There's a lot of, you're at risk for viral, bacterial, all sorts of things. Fungal. I mean, fungal can actually kill you. It's insane. But when your immune system is that suppressed, you're under some pretty strict protocols.
Wow, and you're right. It really sounds strangely like what people are having to do now with
It's totally
coronavirus.
like this. Yeah, now you know what it's like.
Now people can relate more to the experience.
Yes,
So
yes.
what's your advice to people who are having to isolate at home?
My advice about isolating at home would be to really figure out how you can connect with your community, whether that be a community of cancer patients, your community at church, friends, family, through the phone, through social media, if you're comfortable with that, through email, to really make sure that you are um, making sure those relationships continue. And I think finding peers, finding other people who are maybe 6 months or a year out from what you've been through, is unbelievably helpful. To just really, you're going to have a million questions, and to be able to go to some of these communities online and ask those questions from informed people that speak in plain English, not in doctorese. It's really comforting and really helpful.
Okay, perfect. And hopefully this will help with that too. So I'm seeing that you have a lot from March through August here of 2015. So it says vaccine clinical trial. Can you just sum that up for us? What is that?
Sure, it was not a successful trial. Being at a teaching hospital, I was often presented with opportunities to do clinical trials. Some of those were as simple as a one-page questionnaire about my mental health. One that was much more involved was the WT1 study, which was a vaccine looking at a particular mutation that I had and trying to prevent relapse from cancer. And it was an intense undertaking. The drugs were completely covered by the research study, and so all I had to do was just show up, on a staggered basis, first 3 times a week for the first month, and then 2 times a week for the next month, and so on and so forth, until it was like every 3 weeks, and I would receive an infusion. It was actually an injection, but it was very thick, so it was more like an infusion. But I would have to be at the hospital for 4 to 5 hours because they would not make the drug until they saw the whites of my eyes, because it cost, $10,000 per injection. But I did relapse. It was not a successful study. It did not have many side effects for me beyond taking my time. I learned to make my clinic room into my office. I brought my laptop and I would work from there on those days. And it worked out for me, and it was a good transition emotionally and mentally away from this very intensive getting blood counts every couple days, back into life that isn't totally structured around cancer.
Right, right. And speaking of transition, it says April, you were able to return to work full time. Your daughter goes back to preschool. Did you feel pretty much quote back to normal in terms of ability to work at that point? And or were you at home? Did you actually go back to work?
So when I felt like it was time for me to go back into the office, I actually started at home. So we did a trial period of a month where my daughter went back to school. I was healthy enough to have her bringing germs home. And we kind of tried that out to see like how that was going to work. And I worked from my home office, which kind of worked and kind of didn't. I just had the type of job that was difficult to work from home based on a lot of the meetings, and the tech wasn't in place. So I did return to the office. I will say that I had a lot of fatigue. I had a lot of brain fog, and ended up going on more intensive anti-anxiety medication and started a stimulant to help with the fatigue, which was helpful for a short amount of time. And I was able to transition back to the workforce, and it was very gradual. So every month or so, I would feel a little bit more like myself and a little bit more like myself. And I would say after, a year after transplant, I felt like my old self. I was definitely a different person mentally and physically, but my get up and go was back, and my ability to focus. Um, Other things had changed, but I was able to do the things that were meaningful to me.
Good. I'm so glad to hear that. And I do see some notes about some of the other changes. One thing I do want to touch well, I think it's very important you brought
So
up.
this is I've had two cancer journeys. So this is like that's the first one. That's the good one. That's like the billboard. The other one's terrible. So I don't even know if you want to go there.
Well, no, so before I get into that, I mean, you did develop some chronic graft versus host disease, right, in
Yes.
July. Can you just kind of run us through what happened there and how you treated that?
Sure. So I developed graft versus host disease a number of months after my transplant. This is typical. Oftentimes, patients have some sort of acute graft versus host directly after transplant. It can impact any part of your body. It's truly your immune system saying, um, hey, there's some of old immune system here and it's fighting it out. So it can fight it out in your kidneys, it can fight it out in your skin, your muscles, your eyes, what have you. And so I had some dry eye after my first transplant and was able to handle that with basic use of eye drops. But the main factor for me that was an issue was it really felt like I gained arthritis in my hands. And they were very sore. It was hard to do a lot of computer work. It was difficult to do kind of knitting or crafting, things that I regularly did. And that was due to graft versus host in that kind of muscle skeletal area. And so I needed to see a number of different doctors to kind of eliminate all the possibilities that it could be before, because there's no test for graft versus host. It's really kind of observing over time and eliminating all the other things it could be. And so I was able to go on to Celebrex, and that was very helpful. Did physical therapy, was not helpful, didn't do the job, but Celebrex was helpful. Gabapentin, not at all helpful. Um, but Celebrex has really helped. And I still get fatigued. I still have times when I need to massage my hands or put warm packs on there or do kind of stretching.
Okay, got it. So there's some remnants still from it, right, that you're dealing with. Um, you did also the next month in August, it says address sexual side effects. I mean, I think there are all these things that people don't think about. Can you talk about what happened there?
Sure. So, having gone through menopause in my 30s rather early, I had all of the side effects of menopause that people think about, such as hot flashes, irritability. But down the line, I suffered from vaginismus as well as a very dry tissue. And I was able to reach out through my regular gynecologist to a special group at the University of Chicago called Women Lab that works with women at every stage of the cancer process dealing with sexual side effects. You can also get graft versus host disease of the vulva or vagina. I did not have that. That was ruled out. Primarily, the side effects that I was experiencing are very common for people who have gone through any sort of cancer treatment, which was very dry, very irritated tissue. And to be able to engage in a successful sex life with my husband, I needed to go through some physical therapy, which I was able to do at home using dilators, trying lots of different lubricants. And my cancer was not a hormonal cancer. So I was able to use hormonal creams, S-trace, which was helpful and resolved things. But it was a multi-month process to slowly introduce moisture to my body, to make sure that my body didn't poorly react to being uncomfortable and pain and things like that. It took time. You have to dedicate an hour of your day to working through that with the at-home physical therapy.
And women and men who go through cancer treatment who don't have that specific situation, but sexual health is a part of having to work at it again sometimes for people, right? So I mean, I think the message there is sometimes it takes some work. to refocus on that part, but it's important, right?
It is important. I'm on the Woman Lab patient board, and I've helped them with a number of their materials and spoken at conferences. I'm very open about that sexual piece of side effects from cancer, um, particularly for people who are in marriages where you're used to having regular sexual activity, you're used to going on date nights. Cancer changes a lot of that, the fatigue and side effects from treatment. For many people, they stop having sex. They stop engaging in anything sexual for years, months, what have you, depending upon the person. And you have to kind of restart that relationship and those aspects of it. You're probably great with your partner as far as, getting dinner on the table and hopefully paying the bills and working together with childcare, but the thing that gets cut out of many people's relationships is that intimacy is kind of what brought you together in the first place, those connections. So you really do have to reestablish them. For myself and my husband, working with a great gynecologist who was able to help us with the physical aspects, working with marriage counselor to be able to reestablish a lot of those things and to resolve some of the conflicts and issues that came up mentally for us both through treatment.
Okay, perfect. I want to ask, how much time do you have?
I'm free.
Okay.
I
Well,
just at 4 o'clock I have to sign my daughter up for choir stuff, but that's all.
okay, perfect. Okay, well, because you have a lot, of course, because the relapse happens about 2 years later. Why don't we start with that? And then if I have to pause and start a new recording, I will.
Okay.
But yeah, what happened in August of 2017?
In August of 2017, I had my yearly appointment with my oncology team. That's a physical as well as taking blood samples. They typically take 5 or 6 vials, and they're testing for a whole host of different things, comparing it to your last visit. And I felt fine. I thought everything was great. I was moving on with my life, and things were going pretty well. Unfortunately, 2 days later, I received the call that I needed to come in for a bone marrow biopsy because my blood samples didn't look good. They weren't sure, but they needed to get more information. So I came in for a bone marrow biopsy just a couple days later and quickly received the results that a very low level, almost unheard of disease was found in my bone marrow, and that the cancer was back.
Okay. So
Sorry, there's a child running down a hallway near me.
no worries, no worries. That's a lot to digest, of course. And you had been going to get blood tests, like, was it like quarterly at that point?
No, I think at that point it was yearly.
It was yearly. Okay.
Mhm,
Um,
mhm.
so yeah, walk me through. So they say the cancer's back. I
Yeah.
mean, that must have been like a tsunami hitting you.
It was strange because I was so used to the AML process with my experience and many survivors that I've talked to, their experiences. You have AML, you're immediately in the hospital, you're getting treatment. I relapsed with, I think, 9% disease, which was a big complicating factor in a number of ways. So that is unheard of. It doesn't make any sense to give someone with that lowish level of disease heavy duty chemo and put them on the transplant train. Like, there could be other things at play there. I was just lucky that I had a scheduled appointment, and it was a well visit typically in my mind before I knew it was cancer again. So they found it very early. So they were actually able to take some time and look at a number of different ways to treat this. I was treated outpatient for the first little more than a year of relapsing. We tried a number of different drugs. So we tried a drug called azacitidine, which is often used for pre-blood cancers. MDS is that blood disorder, and that can it was successful for me that it was able to keep me at that 9%. My body, had very little side effects. I didn't lose my hair or anything like that from this particular drug. It is a low dose chemo. I did have to go in for those treatments, but I was able to lead my life at home. I did know at that time that a second occurrence of leukemia, does not have great odds. So I immediately quit my job and went on disability. The disability process takes 6 months or more if it's fast tracked. So I knew from my experience working with other survivors that I needed to do that and do that quickly.
Okay, and I do want to get into that later too. But this drug, so it was an infusion that you'd have to go into the hospital. Was it one day a week? How did that look?
I really Okay, cats. What is going on? I don't really remember exactly how often they mixed it. They like tried a number of different things, and it may have been in conjunction with another drug. It was not more than one. I was going into the doctor's every 1 to 2 weeks, mainly for like blood samples, but also there was infusions in there too.
Okay, and that
So
lasted for about how
And
long?
that was, yeah, I was on azacitidine for a little over 6 months, and then it stopped working. So they were starting to see more development of disease, and they decided to try a clinical trial for venetoclax, which at that point in time was only approved for another type of cancer, CLL. And it was in trial to be seen if it was an immunotherapy that was effective for AML. So that I received directly from the manufacturer. The manufacturer paid for it. It was unbelievably expensive. And it was packaged like you would receive like a pack of pills, kind of like a booklet. And I took that at home, and there was a very specific way I had to take it. I had to do weekly check-ins with the pharmaceutical company, and weekly check-ins with my doctors. It didn't really do anything. For my particular case, it didn't have many side effects either. And they really wanted to give it a good go because it had been successful with other patients. So they wanted me to take it for at least 4 months before they would abandon this treatment regimen. So I took it for a while, and then we started going back down the the transplant route.
Wow, okay. The pill that you were taking, was it once a day? Do you remember? Or was it
Yes.
okay, it was once a
It
day.
was once a day, but there were when it was time for me to get off of that particular pill, there what they did it had to be stepped down in a certain way.
Okay, but it didn't improve your blood level, blood cell level.
It
Okay,
did not.
okay. So then your doctors made the call, let's get you off of this. Let's do the pre-transplant regimen. Can you just describe what that was again, that whole process?
Sure. So, since I did have a low level of disease, my trajectory towards transplant the second time around was quite different. I did not have to do induction and consolidation I really, that was all compressed all together before my transplant. So I checked into once my donor had been picked and all of that paperwork was put together, schedule was put forward, we could move a little slower. And again, November, I checked back into the hospital and began high dose chemotherapy for the week before my transplant. And they added to that full marrow radiation. So it's not quite full body radiation. I had 3 of those visits that took a very long time. They tattooed parts of my chest and my stomach, and that's where they aimed the radiation. Um, and that is just like an extra thing because my body, it didn't they wanted to do something different than they did the first time around, than just standard protocol. They wanted to add some bigger guns to try and have my transplant be more successful long term.
Because the radiation was an additional sort of layer, is there anything else you can say to describe that process? And also if you had any side effects from it?
The tran the radiation was pretty hard mentally. Having to be still, having to have casing over my face, kind of this web fitted to my face, um, and having like doctors move in and out of the room because of you're undergoing something really toxic, um, was very scary. Was really I didn't know how to prepare myself for it. I didn't really know much or anything about that process. Um, my previous treatments had been pills or infusions, and you have a little bit more, control over your body and your surroundings and how you distract yourself. You are completely in the moment when you receive radiation. So that, I think, being unable to distract myself, even though they played good music and things like that, it was difficult. I did have major side effects from the radiation. My adrenal system did fail, and I began losing consciousness upon standing after I actually lost consciousness the last time I did radiation, trying to get on the table. I collapsed and they called, cart and all that sort of stuff. And I did come back. I didn't injure myself. I had some bruises, but they did go through with radiation because I needed it after that, which is just bizarre. Um, but no, it did. The radiation has done some considerable damage to all sorts of parts of my body.
Wow. So it was very high dosage. How many times did you have to get that radiation?
Just three. I mean, it was a couple hours each time, but there's so much positioning and moving. Like, I don't know how much of that time I was actually receiving the radiation, but um, it was hard.
Sounds so rough. Oh my gosh. You had to go to a separate room for that, and
Yeah, so I was transported from my inpatient room to the basement of a nearby building because they want to keep the radiation away from most people, and so went through that and was transported wheelchair back and forth through the transportation hospital. Twilight, you need to be quiet. Quiet. Sorry. There's a lot of running around here with cats right now.
no worries.
So yeah, so it was all done, within the hospital itself.
In that room in the basement, was it just like a very white, sterile sort of room? Is it a different sort of contraption than, of course, say like an MRI, right? So like, can you describe what that looks like?
It really felt like I was in a supply closet. So there was all this different equipment on the walls, mainly boards and bolsters and things to get a body in a really specific place. Um, I think this type of radiation, because you're dealing with the whole body, is not done as commonly. So it's not a pretty white room. It really did kind of feel like, a supply closet or something like that.
Okay, gotcha. And how long after the radiation, these three major doses, did you, kind of go on to the next part of this experience?
I believe I had radiation in the morning, my last dose of radiation in the morning, and then had my transplant later that day. And it was a really rough day. It wasn't this happy birthday type thing because I had started to lose consciousness and had blood pressure issues. So they were running. I was up all night with tests. I was taken for CT scans and MRIs and all sorts of neurological examinations and all sorts of other things to try and find out what was wrong, and everything was inconclusive. It was very difficult to try and figure out what was happening. um, they found things like I have a partially empty cella system, but in empty cella, not system, but partially empty cella, but that did not factor into this. That was just another thing they uncovered, that may or may not be a problem down the line in my life. But yeah, no, I was losing consciousness a lot and was put on bed rest, which at that point, all the side effects of the chemo kicked in. So I had vomiting and diarrhea all the time and could not take care of myself. And so I was really at the mercy of wonderful nurses who took care of me and cleaned me up a million times a day. It was a totally different experience because I really wasn't really able to advocate for myself very well. I'm a medical marijuana user, and that had very much helped me the year before my second transplant mentally to kind of um, deal with the depression and anxiety. And so I wanted to use that in the hospital during my second transplant. And I didn't smoke or anything. I just used edibles, but they really discouraged that. They didn't want that to happen, and I understood. So I was given the synthetic version of marijuana, which is called Marinol. It's a pill, and I hallucinated for days on end, and it was terrifying. And we realized that was what was going on. So they took me off of that, and it was hard. It was really, really hard.
Oh my gosh. I mean, you've been through so much uh, up until this point. I mean, how long are you in the hospital until?
I was in the hospital for I think 6 weeks. It wasn't, I mean, that's long, but everyone totally lost, my family lost their minds when they did decide to let me go home, because I live in a brownstone building with a big staircase. And I mean, I was collapsing constantly. I was like this major, major fall risk and needed so much care. So like just trying to figure out, someone who doesn't have an immune system is totally isolated. At that point, my body stopped making magnesium and potassium. So I needed to be taken to the clinic every single day, sometimes twice a day for hours at a time. So that was at least a little bit of a relief for my family to be like, okay, she can go and be with that team of nurses and be taken care of and give us a break and take care of, this kid, my daughter, um, while all of this is going on. And we're all on super high protocols at home. Like, you come home, that you sanitize, you leave your shoes outside, we're constantly washing clothes at high temperatures and all that sort of stuff, because I was very much at risk and it like I physically was more vulnerable looking and acting than I ever had been. I really came home as a very different person. um, and then I started to have some cardiac issues that would come and go. We think it's due to one of the chemo agents that I had in 2014. I think idarubicin is what they decided, that I have heart failure. So that has to be mitigated, not mitigated. That heart failure has to be managed. It's not a considerable amount of heart failure. The other thing that's really important after transplant is monitoring pulmonary, because it can go down very quickly. Graft versus host disease of lungs is common, but if it's caught early, it can be dealt with. I was doing great pulmonary wise, doing all my testing monthly, and then my pulmonary function just dropped with any exertion. And this is right when we were kind of figuring out how to repair my adrenal system. So I was like not having to use a walker all the time or a wheelchair. I was starting to you know, make my own cortisol. And then my pulmonary function just tanked, and they put me on oxygen 24 hours a day, which was scary because you're flammable. Um, that was my main thing, is like, I cook, I can't do anything. So, but I worked with the most amazing pulmonary specialist, and she was able to really work with me and figure out that this one particular anti-pneumonia drug that I was on, called Dapsone, was just destroying my pulmonary function. And so literally, after struggling for months, one day of being off Dapsone, my pulmonary function was completely normal. Off oxygen, returned everything. Was bizarre.
So you have had to go through countless complications. Before we kind of wrap to go into the like emotional, mental part of this, um, what was there anything else that you'd want to just sort of tell people about how like what you went through that you think is very important to get through? Because I feel like a lot of this is also, unfortunately for you, unlucky, rare. You mentioned many
Yep.
times, so a lot of this isn't supposed to happen, right?
Well, with second transplants, everything's off the table, or everything's on the table, however you want to put that. The possibilities of having major complications are just way more significant if you survive. You know, the 50-50 is what I was given initially with transplant. So this is better than that. I think for me, going through the cancer experience, for many of us, society expects for us to go through treatment, reach remission, and everything goes back to normal. And I don't think that's the case for anyone who's had a cancer story or a cancer journey. Many of us have lifelong chronic conditions. Many of us will, after years of getting kind of back to normal, will have a setback, a recurrence, a new cancer, or a later effect, later in time side effect from one of the agents that saved your life. And it's difficult, and it's difficult, I think, for people to understand because it's not communicated in the media, and it's not always supported within the cancer nonprofits in those communities. People, heavily focus on that time of intensive treatment, and then you're supposed to be done. And that's really not how it works. And the mental health side effects are significant as well. It changes perspectives. It changes your anxiety level and all sorts of things. So I think it's really important to shine a light on people who are still struggling, but making their life as positive as possible. Even if you're stuck in bed most days of the week, if you've got that one day where you make an amazing dish or spend really quality time with someone who's important to you, that's still a life. That's still important. You still matter. I think that's very, very much an important thing to center in your world, that we don't know what's going to happen. And that's very hard, but we're stronger than that. And we can find a way to make a new life.
That was beautifully said, Mary
I'm
Claire.
thinking. I'm thinking about our. I have a couple of friends who have a lot of really, really, like, my story is like beautiful and easy compared to a number of people I know who are, in their 30s and 40s and are so permanently disabled, will never walk again. They're losing their sight because of transplant complications. So I'm fortunate that I already had a husband and a kid. Like, I've got a friend who's trying to figure out how to date with all of this. And yeah, it's hard.
It's perspective too, right? Everything is just putting things into perspective. Given all that you've been through, and I mean, what helped you the most, right? Because I think something else that people don't think about is the effects of encountering bad news over and over again. Just like the mental effects that that can have on someone, where you're constantly dealing with something else. Humans are very resilient. You truly are. How did you, though, outside of that, really feel you were able to, not just move on, but move on and heal? What would your guidance be to other people on that?
I don't think I've moved on. I think that I've learned how to manage um, the uncertainty, the side effects, the just not knowing if things will come back, and also just acknowledging that you know the support system that you think you had isn't always there. Your world gets pretty darn small sometimes, but there's a lot of beauty in that. For me, things that were just surprisingly helpful were, these close relationships that were sometimes fraught with family, that have really grown in new ways. Like, my mom and my husband are now very good friends, and that just makes my heart sing. My spiritual community, my church, has been very important to me, and that I was very active and involved before cancer, and I worked with all the youth in my Unitarian church. But now I'm not able to do that, so I'm able to support in different ways, and had to learn how to be supported, which was hard, but necessary. But the other things that are really helpful for me have been nature, finding ways to, go outside. I was stuck for so long in hospitals and in my own home that just walking to the park or Lake Michigan here in Chicago, it's just unbelievable and unbelievably important to me to be standing outside, even if it's with a mask and a hat, just feeling the sun is just life changing, as well as creating and making things. I make jewelry, I paint, I write, and I share my story. I think those are ways that I feel like I'm still contributing to the world. I'm still able to be part of something and make something. And in the same way, music and reading and audiobooks um, really, really have helped bring meaning to my life. My first transplant, my so scatterbrained, so all over the place, I could just kind of watch junk food TV and that was about it. And that gets old fast. Especially someone like myself who loves books and loves literary fiction and poetry and things with a million footnotes. Finding audiobooks and very wonderful narrators the second time around, like it just fed my brain in a different way that was really life giving in that kind of brain way.
I love that. Really good advice for people, different resources to go to. I want to ask too, just about in terms of relationships. You touched on that a little bit. Your world got much smaller. How did cancer impact your relationships, with your husband, with your mother? And then I do want to ask maybe some advice for people on how to manage through those changes.
Sure. Um, when I was initially diagnosed, and again the second time, a lot of friends fell away. Friends that I had known for years and years and years, and for many reasons that I will never know. I think for some people it's just difficult to face cancer if they've lost someone, or to face a friendship that is not just going and getting coffee and enjoying each other's company. It becomes much more serious. There's still a lot of play in my world and a lot of fun, but it became smaller. It became, my mom and my husband and my daughter and a couple close friends. And sometimes those friends would shift and change month to month because it is really exhausting and taxing. And I think to have friendships that you can in some ways find an escape from cancer, people that you can, if you need. I have people in my life that I know I'm not going to sit down with and go through all the awful things that are going on with me. When they say, how are you, I'm going to say, hey, let's talk about this book we both just read, or this movie, or what are you cooking, all of those kinds of things. And to, you compartmentalize things in a healthy way. And you all can also realize that you are more than cancer. And that is just a huge mountain to climb. For me to be the advocate that I needed for myself and my family, cancer was really just the be all end all. Everything that I was focused on, everyone was focused on. And it was hard to take myself out of that to be able to have a regular conversation. It felt like I was living in some sort of alternate universe and I couldn't connect with anyone. And it took time and patience to be able to figure out how to be authentically me, angry about cancer, advocating for myself, still being hopeful, but also having, you know, uh, friendships that were maybe a little more surface level, and that's okay. And there are going to be people who leave your life, and it doesn't make any sense to dwell on that. You can be sad, you can feel those feelings, but moving forward, I've met so many amazing cancer patients and survivors and doctors and researchers, that fills that void 10 times over.
Okay, wonderful. And how about with your daughter? How did you handle telling her about, quote, being sick? How did you manage that?
Sure. So when I was first diagnosed, my daughter was 3, and was pretty clueless beyond mom is sick. She's a smart young lady. She's got her own setbacks, but she is inquisitive to the nth degree. So there was no keeping things from her. I brought her to doctor's appointments. When she was able to visit the hospital, we brought her. We didn't shield her from much. We didn't go into big, long details if something was going on, but if something was happening with my heart, I told her. We had many medical supplies at home. My lines had to be cleaned. Things had to be, you know, infusions at home happened at some point, and she learned how to do all that stuff when she was 3 and 4. So she's probably a future doctor. Uh, you know, over time, when I've had major mobility issues and issues with syncope and things like that, she is a caregiver. I mean, her capacity to take care of other people is well beyond her years, and well beyond what anyone would expect from a child. And it breaks my heart to think that I've taken part of her childhood and innocence away from her. But I don't think we could have survived any other way. She's very close relationships now with my mom and her grandma and my husband's mother, her other grandma, that would have never ever happened if cancer didn't come into our world. Um, you know, she'll tell the grocery clerk about cancer in our world, and she's she's amazing.
I have a daughter, so that makes me just really my heart sing. And I forgot to ask, obviously, such a huge question. I mean, so you went through the second transplant, and where are you now? I know you had a lot of things that you had to overcome, and it's still going on. What's your status right now?
So we've been able to manage a number of the after effects of my transplant. Some are ongoing. I'm one of the healthier people in the oncology office, but I have a new primary care physician, and I'm like the sickest person she's ever seen. So that was like, but at this point, you know, heart and lungs and you know, sexual side effects are managed by treatments and therapies. I go to the doctor more than the average person. I'm able to lead a pretty normal life. Fatigue is still a major factor. And I will just have days where I just need to go back to bed. And that's becoming less, but it's still there. I have managed once my adrenal system came back, many of my symptoms and the constant dizziness and verge of collapse resolved. Now, when I have fatigue, I am very dizzy and need to really mind myself so that I don't lose consciousness. But that's typically on a day-to-day managed by a supplement of salt because my body just doesn't do that. My blood pressure is very low. I'm still waiting. I've been waiting over a year to see the person who handles this type of stuff at Mayo. So hopefully this summer I'll get to see him. I started working part-time in the end of December for BMT Infonet, and I manage their social media and help them with editing and writing. I'm hopeful uh, that my health will continue to be well. I was thinking about, before the economic collapse we're under, going back to working full-time, probably from home, doing some sort of teaching. That's my background, is in teaching journalism, as well as college administration, but I really miss teaching. I miss being around young people and teaching kids how to write and make videos and all that stuff. So I'm hopeful to get back into that.
Wonderful, but it seems like you are you're in good spirits, and are you having to go back to get blood tests every so often?
Yeah, so I'm on a monthly basis right now, though things are totally out the window. Um, and they have to closely monitor, like probably I'm on an every 3 months with like the endocrinologist and um, cardiologist and somebody else. And I do a lot of work on my mental health. I have a therapist. My daughter has a therapist. My husband has a therapist. We have like family counseling, and we're all very upfront with each other what we need. And I totally take antidepressants and anti-anxiety medications, and for chronic pain as well as anxiety, medical marijuana has been a game changer and lifesaver for me. Big advocate for that. And yeah, I mean, my life has definitely taken a big step back. The financial hit of going from being a dual wage earning professional household to one income and some disability money,
Right.
also during a time when my daughter was diagnosed with profound dyslexia and needed to be in a very different, excuse me, educational environment. Just, I mean, we'll never be able to retire. I don't know, but I think we're still kind of in denial about some of that. But
You're just taking
yeah,
it one step at a time, right? I mean, you can only do so much processing and
yeah. So we'll declare bankruptcy one day. It'll be fine. I
there's
don't know.
the humor. The I don't want to use the wrong word either. Do they say that you're in remission, technically?
Yes, I
Okay.
am. I am in remission. You could call me Ned if you want to. No evidence of disease.
Oh,
So all of those things are good. Yes,
yeah.
definitely, definitely.
Okay, good. And the last thing I'll ask you, thank you so much, by the way, for all this time.
Sure. No, I know I have a long story, so I'm used to these things taking longer.
Is, just one thing you'd want to say to the person who's reading and watching and hearing. We're going to do different formats of this, but first is reading your story. Someone who's just been diagnosed or is in the process, and some of these people too are caregivers. What would you like to say to them?
The best piece of advice that I was ever given, I asked my doctor, should I stop drinking coffee now that I'm a cancer patient and all of this? And he said, absolutely not. You should continue drinking coffee and doing your morning routine because you have a new job. Your job is being an advocate for yourself. And that I have taken to heart time after time, and it has really structured my world and made me realize that I'm not a victim. I am advocating for myself, and I can make a difference in my own health and the health of others.
Wow, I love that. That is so okay.